Welcome back to our channel. Today, we're diving into an essential topic, recognizing the early warning signs of kidney issues. The kidneys are crucial organs, and spotting signs of trouble early can significantly impact your overall health. According to recent statistics from the International Society of Nephrology, over 500 million people worldwide are currently living with various chronic kidney conditions. Before we get into the details of these warning signs, it's important to understand the significance of kidney health. These vital organs are responsible for filtering waste and excess fluids from our bloodstream, and when they're not functioning properly, it can lead to a cascade of health problems. So, what are these early signs of kidney problems, and how can we detect them before they become more serious issues? Before we begin, it's crucial to emphasize that this video is for educational purposes only. If you have any health concerns, we strongly recommend consulting with a medical professional. 1. High blood pressure. High blood pressure, also known as hypertension, can be a warning sign of potential kidney issues. The kidneys play a key role in blood pressure regulation by carefully managing the body's fluid levels and the dilation of blood vessels. In people with healthy kidneys, these organs secrete hormones that help maintain stable blood pressure. For example, when blood pressure is low, the kidneys release renin, which triggers a series of reactions that raise blood pressure. On the other hand, if blood pressure is too high, the kidneys secrete atrial natriuretic peptide, which helps lower blood pressure by promoting the excretion of sodium and water. However, when kidney disease is present, these regulatory processes may not function properly. This can lead to an imbalance in fluid and electrolyte levels, causing an increase in blood pressure. This situation can create a harmful cycle, as high blood pressure can further damage the kidneys, leading to worsening kidney function and even more severe hypertension. Early stages of kidney disease often do not present clear symptoms, making hypertension a critical early warning sign. Symptoms of advanced kidney disease may include swelling, edema, fatigue, nausea, and difficulty concentrating. If not addressed, the condition can escalate, leading to the need for dialysis or a kidney transplant. Managing high blood pressure through lifestyle changes, such as a low-sodium diet, regular exercise, and medication, is crucial in preventing or slowing the progression of kidney disease. It's also essential for individuals at risk to have regular blood pressure screenings and kidney function tests to detect any issues early. 2. Muscle cramps. Muscle cramps are a common and often painful symptom for individuals with kidney disease, particularly those undergoing dialysis. These cramps can be caused by several factors, primarily stemming from electrolyte imbalances and fluid shifts in the body. One of the primary causes of muscle cramps in dialysis patients is the rapid removal of fluid during treatment, which can lead to a condition known as intradialytic hypertension, low blood pressure during dialysis. This condition can reduce blood flow and oxygen supply to the muscles, causing them to cramp. Additionally, the removal of essential electrolytes such as sodium, potassium, calcium, and magnesium during dialysis can disrupt normal muscle function, leading to cramps. Electrolyte imbalances, specifically low levels of potassium, hyperkalemia, and calcium, can interfere with nerve and muscle function. For example, hyperkalemia can lead to symptoms such as fatigue, weakness, and muscle cramping. Furthermore, inadequate magnesium levels can exacerbate muscle cramps and cause additional symptoms like muscle weakness and spasms. To manage muscle cramps, patients can take several preventive measures, including maintaining proper hydration following a dialysis-friendly diet that regulates sodium and fluid intake, and ensuring adequate intake of essential electrolytes. During dialysis, adjustments in the rate of fluid removal and the use of isotonic solutions can help alleviate cramps. Patients are also encouraged to engage in mild physical activities, stretch, and massage affected muscles to reduce cramping. 3. Changes in urination. Changes in urination, such as variations in frequency, volume, or appearance, can signal underlying kidney issues. One of the earliest and most noticeable symptoms of kidney dysfunction is an alteration in urine output. A decrease in urine production, known as oliguria, can occur due to factors like dehydration, medications, or kidney disease. In severe cases, individuals may experience anuria, a complete absence of urine output, which is often associated with advanced kidney conditions. Foamy or bubbly urine may indicate the presence of protein in the urine, proteinuria, a common sign of kidney damage. This occurs when the kidney's filtering units, glomeruli, are damaged, allowing proteins that should remain in the blood to pass into the urine. Hematuria, or the presence of blood in the urine, can be a sign of kidney damage, infections, or kidney stones. The appearance of blood can vary from pink to dark brown, depending on the amount and location of the bleeding within the urinary system. Another indicator is changes in urine color and concentration. Dark concentrated urine may suggest that the kidneys are not properly filtering waste, which could be due to dehydration, medication effects, or kidney disease. Additionally, nocturia, or the need to urinate more frequently at night, can be an early sign of kidney dysfunction as the kidneys lose their ability to concentrate urine. These changes often occur gradually and may not be immediately noticeable. Therefore, regular monitoring and timely medical consultation are crucial for early detection and management of potential kidney problems. If you notice any unusual changes in your urination patterns, it is advisable to consult a healthcare professional for proper diagnosis and treatment. 4. Changes in mental state and mood. Did you know that kidney health can significantly influence your mental state? Chronic kidney disease, CKD, can have profound effects on mental health and cognitive function. As kidney function declines, the accumulation of waste products such as urea and creatinine can lead to a condition known as uremia. This condition can impair cognitive abilities, causing symptoms like confusion, difficulty concentrating, and reduced mental sharpness. It can also manifest as mood disturbances, including depression and anxiety. The relationship between kidney disease and mental health is complex. For instance, the buildup of waste products and toxins can lead to cognitive dysfunction and mood swings. Additionally, disruptions in electrolyte levels, particularly sodium and potassium, can further exacerbate these issues. For example, hyponatremia, low sodium levels, can cause confusion and cognitive changes, while hyperkalemia, high potassium levels, can lead to muscle weakness and fatigue, further affecting mental clarity. Mental health issues in CKD patients are not limited to physiological factors. The psychological burden of living with a chronic illness, the stress of managing the disease, and the financial and social implications of treatments like dialysis can all contribute to anxiety and depression. The prevalence of depression in CKD patients is notably high, with symptoms often overlapping with physical symptoms of the disease, such as fatigue, sleep disturbances, and appetite changes. Furthermore, there is evidence suggesting a link between CKD and an increased risk of dementia. The presence of albuminuria, a common indicator of kidney damage, has been associated with a higher likelihood of cognitive impairment and dementia. This connection underscores the importance of early detection and management of kidney disease to potentially mitigate these risks. Patients experiencing these symptoms are encouraged to discuss them with their healthcare providers. Treatments may include medications, counseling, and support groups to help manage both the physical and psychological aspects of the disease. 5. Swelling in the hands, feet, or ankles. Swelling in the extremities, known as edema, is a common symptom associated with kidney disease. It occurs when the kidneys are unable to efficiently remove excess fluid from the body, leading to fluid accumulation in tissues. This can result in noticeable swelling in areas like the hands, feet, ankles, and sometimes even the face. The condition may also cause weight gain due to the retention of fluids. Edema in kidney disease often stems from the kidney's reduced ability to filter out waste products and excess sodium from the blood. This inefficiency causes fluid to build up in the body's tissues, leading to puffiness and swelling. Additionally, low levels of albumin, a protein in the blood, can exacerbate this swelling because albumin helps regulate fluid distribution in the body. edema can also be a symptom of other serious health conditions such as congestive heart failure, liver disease, or issues with the lymphatic system. For example, congestive heart failure can cause fluid buildup in the lungs and other parts of the body, while liver disease can lead to ascites, a condition characterized by fluid accumulation in the abdomen. If you experience significant swelling accompanied by symptoms like shortness of breath, chest pain, or abdominal discomfort, it's crucial to seek immediate medical attention, as these could be signs of a more severe underlying condition. For managing edema, lifestyle changes such as reducing salt intake, wearing compression garments, and elevating the legs can be helpful. In more severe cases, medications to help remove excess fluid may be prescribed. It's important to work closely with healthcare providers to manage both the symptoms and the underlying causes of edema. 6. Fatigue or weakness. Fatigue and weakness are prevalent symptoms experienced by individuals with chronic kidney disease, CKD. These symptoms occur due to the kidney's reduced ability to filter waste products and toxins from the blood, leading to their accumulation in the body. This buildup can result in a persistent feeling of tiredness and weakness, affecting daily activities and overall quality of life. One of the significant contributors to fatigue in CKD patients is anemia. Anemia arises when the kidneys fail to produce sufficient erythropoietin, a hormone responsible for stimulating red blood cell production. Reduced red blood cell levels mean less oxygen is transported throughout the body, leading to fatigue and decreased energy levels. Additionally, electrolyte imbalances such as low levels of calcium and high levels of phosphorus can also contribute to muscle weakness and fatigue. CKD can also lead to poor sleep quality, exacerbating fatigue. Sleep disturbances are often linked to the accumulation of toxins that disrupt normal physiological processes. This can result in symptoms such as difficulty concentrating, memory issues, and general cognitive impairment. Fatigue in CKD patients can also be influenced by other factors, including nutritional deficiencies, medication side effects, and the psychological impact of managing a chronic illness. It is important for patients to discuss these symptoms with their healthcare providers to develop a comprehensive management plan that may include dietary adjustments, medications, and other supportive measures. 7. Itching and dry skin. Patients with end-stage renal disease, ESRD, often experience itching, pruritus, and dry skin, especially those undergoing dialysis. This condition, known as uremic pruritus, affects a significant proportion of dialysis patients and can greatly diminish their quality of life. The underlying causes of uremic pruritus are complex and multifactorial. One primary factor is the accumulation of uremic toxins in the bloodstream, which are typically filtered out by healthy kidneys. These toxins can lead to systemic inflammation and skin irritation, causing persistent itching. Another major contributor is the imbalance of electrolytes, particularly elevated levels of phosphorus and decreased levels of calcium. These imbalances can cause calcium phosphate deposits in the skin, intensifying the itching sensation. Additionally, reduced functioning of sweat and oil glands in kidney disease patients often results in dry skin, further exacerbating the discomfort. Fluid restrictions common in dialysis patients can also worsen skin dryness. Other factors that may contribute to itching include increased levels of parathyroid hormone and potential allergic reactions to dialysis materials or medications. The symptoms of uremic pruritus can vary, with some patients experiencing localized itching while others have generalized discomfort. The condition tends to be worse at night, often disrupting sleep and significantly affecting daily life. Managing uremic pruritus involves a multifaceted approach. Topical treatments such as moisturizers, emollients, and creams containing menthol or capsaicin can help soothe the skin and provide relief. Medications like antihistamines, gabapentin, pregabalin, and specific drugs like difelikefalin are often prescribed to alleviate itching. Ensuring adequate dialysis to remove toxins effectively is also crucial. In some cases, phototherapy with UVB light has been found beneficial. Lifestyle modifications, such as using mild soaps, avoiding hot showers, and maintaining good skin hydration, are practical steps to manage symptoms. 8. Shortness of breath. Shortness of breath, or dyspnea, is a common symptom that can arise from various medical conditions, including kidney disease. In the context of kidney problems, dyspnea often results from fluid overload, a condition where the kidneys fail to remove excess fluid from the body effectively. This fluid can accumulate in the lungs, leading to pulmonary edema, which significantly impairs breathing. Pulmonary edema occurs when fluid collects in the alveoli, the small air sacs in the lungs, making it difficult for oxygen to pass into the bloodstream. This condition can cause symptoms such as difficulty breathing, a feeling of suffocation, wheezing, and coughing up frothy sputum that may be pink due to the presence of blood. In severe cases, pulmonary edema can lead to life-threatening respiratory failure, requiring immediate medical attention. The causes of pulmonary edema in kidney disease patients are multifactorial. Cardiogenic pulmonary edema is often linked to heart issues, such as congestive heart failure or cardiomyopathy, where the heart struggles to pump blood efficiently, causing fluid to back up into the lungs. Non-cardiogenic pulmonary edema can result from conditions like acute respiratory distress syndrome, ARDS, infections, or reactions to certain medications. The management of pulmonary edema typically involves addressing the underlying cause. Treatment may include diuretics to remove excess fluid, medications to support heart function, and oxygen therapy to improve oxygen levels in the blood. In severe cases, mechanical ventilation may be necessary to assist with breathing. Preventive measures include managing risk factors like high blood pressure and adhering to treatment plans for underlying conditions. 9. Back pain. Back pain, particularly in the lower back or flank area, can indicate kidney issues, including infections or kidney stones. The kidneys are located near the lower back, just below the rib cage, making this region a common site for kidney-related pain. Kidney infections, pyelonephritis. This infection typically arises from bacteria traveling up the urinary tract to the kidneys, causing inflammation. Symptoms often include severe back or side pain, fever, chills, and urinary symptoms such as frequent urination, burning sensation, or cloudy urine. Pyelonephritis can also lead to systemic symptoms like nausea and vomiting. It's crucial to treat kidney infections promptly with antibiotics to prevent complications such as kidney damage or sepsis. Kidney stones. These are hard deposits made of minerals and salts that form inside the kidneys. When stones move through the urinary tract, they can cause intense pain, known as renal colic, which typically starts in the back and may radiate to the lower abdomen and groin. The pain can be intermittent and vary in intensity. Other symptoms may include nausea, vomiting, hematuria, blood in the urine, and difficulty urinating. Treatment options depend on the size and type of stone and may range from increased fluid intake and pain management to surgical interventions like lithotripsy or ureteroscopy. In both conditions, timely medical evaluation is essential to determine the underlying cause and appropriate treatment. For kidney infections, antibiotics and hydration are the mainstays of treatment. For kidney stones, management may include medications, lifestyle changes, or procedures to remove or break down the stones. 10. Nausea, vomiting, and loss of appetite. In advanced kidney disease, symptoms such as nausea, vomiting, and loss of appetite are common and can be particularly distressing. These symptoms arise from the accumulation of waste products and toxins in the blood, a condition known as uremia. As kidney function declines, the ability to filter out toxins diminishes, leading to a buildup of substances like urea and creatinine. This buildup can trigger gastrointestinal disturbances, resulting in persistent nausea and vomiting. Additionally, the disruption of normal electrolyte balance, such as increased levels of potassium and decreased levels of calcium, contributes to these symptoms. These imbalances can affect gastrointestinal function, exacerbating the feeling of nausea. Furthermore, the taste of food can change, often leading to a metallic taste in the mouth, which can diminish the desire to eat. Medications prescribed for managing kidney disease, including certain antibiotics, painkillers, and chemotherapy drugs, may also cause gastrointestinal side effects. These can further aggravate the symptoms of nausea and vomiting, complicating the overall management of the disease. The loss of appetite in kidney disease patients is also linked to hormonal changes. For example, reduced production of certain hormones that regulate hunger can lead to anorexia. This, combined with nausea and vomiting, can contribute to malnutrition and weight loss, significantly affecting the patient's quality of life. Treatment focuses on managing the underlying causes and symptoms. This may include adjusting medications, using anti-nausea drugs, and implementing dietary changes to accommodate reduced appetite. In severe cases, dialysis may be necessary to help remove toxins from the blood, thereby alleviating symptoms. For those with end-stage renal disease, a kidney transplant may offer a more permanent solution. Regular monitoring and proactive management of these symptoms are crucial for maintaining quality of life and preventing further complications. Recognizing the early warning signs of kidney issues is crucial for maintaining overall health and preventing the progression of kidney disease. The kidneys play a vital role in filtering waste and excess fluids from the bloodstream, regulating blood pressure, and maintaining electrolyte balance. Symptoms such as high blood pressure, muscle cramps, changes in urination, mental state alterations, swelling, fatigue, itching, shortness of breath, back pain, and gastrointestinal disturbances can all indicate underlying kidney problems. Prompt detection and management of these symptoms can significantly impact treatment outcomes. It is essential to seek medical advice if you experience any of these symptoms, as early intervention can prevent further complications such as chronic kidney disease, kidney failure, and the need for dialysis or a transplant. Regular checkups, lifestyle changes, and adherence to prescribed treatments are key components of managing kidney health and maintaining a good quality of life. If you found this information helpful, please give this video a thumbs up and share it with your friends and family. Don't forget to subscribe to our channel for more health tips and wellness advice. Thanks for watching. See you soon in our next video. Goodbye.